Good morning. I'm Wendy Jones, your host and also owner and operator of Next Steps for Seniors, the business. And welcome to our radio program. Each and every week, we do the best we can to help really give you information and resources to help you with your aging parent or loved one, or maybe it's yourself. And this week, our topic is knee pain and what can be done about it. Osteoarthritis is so much more than a wear and tear problem. It's a progressive joint disease that affects millions worldwide. And now that people are living longer, incidence rates are continuing to climb. Clearly, osteoarthritis of the knee is becoming an alarming problem. And there's many people out there that have this problem. And that is why today we have New Life Medical with us. And her name is Rakel Assk. Good morning, Rakel. How are you today?
Good morning. How are you?
We are excited to have you with us today. New Life Medical is a great partner of this radio program and a big supporter, and so we appreciate you and all that you do for our patients and clients.
Thank you for having us today. We appreciate it so much.
And Rakel, tell us a little bit about, I know you're located in Beverly Hills, but just kind of if you can explain the main objective of New Life Medical, that would be awesome.
So at New Life Medical, we're just trying to change people's lives. Getting up in the morning with a very stiff knee, having some knee pain, osteoarthritis that they don't want to have surgery to fix. We're there to give them alternative treatment to help them with their knee pain and go about their normal days. So we're changing lives day by day, and we really like to make an impact on our patients' lives. So,
How do you, like most people who have knee pain, this is just me asking the question because, like my mom, for example, has horrible knee pain, but she has no idea what it is, how it got there. She's 72, 73 years old. So when you get to a certain age, and do you need like a script to go to a doctor to come to you, or can you just come into the office and call?
No, you can just come right on in. We do free consultations. They're free, no obligation, no cost consultations. So you just come on in and we go over your past medical history, past surgical history. We take complimentary x-rays. They're completely free. And that way we can determine the best treatment plan for you and go over it together, and you can see exactly what's going on with the knees. So we're pretty detailed, and you don't need to go see your primary care provider seeing us.
Yeah, I really do think that everyone thinks that they need a script or they need to go to their primary care first before they can come to you. So I love that you have that available.
Yeah, of course.
So tell us a little bit about this hyaluronic acid protocol.
So hyaluronic acid is an all-natural substance. It's a natural shock absorber, so it's a lubricant within the joint space. Our bodies naturally have hyaluronic acid. It's found in our skin, hair, nails, and in between our joint spaces. The older we get, the more we lose the hyaluronic acid in our bodies. So what we're doing is we're replenishing what we've lost. So it's a series of 5 injections because evidence-based practice has proven that 5 injections gives you a good enough cushion to where you can walk around and feel much better. There are other practices that offer 1 or 2 or 3. We offer 5 just because we notice that patients have a better outcome from 5. And we also use guided imagery in our office, meaning that we take a live image with x-ray. It's called fluoroscopy. And we do this every every injection that we do just to make sure it ensures 100% accuracy. We're in the right spot. We're not going blind. We make sure that the patient can see it as well, so it's live imaging. And then we also offer a knee brace. So the knee brace is an offloading knee brace, and it helps increase the joint space so that the hyaluronic acid can spread better, and patients have relief when they're having so much pressure on the knees for a long period of time. If they're standing for long periods of time, or if they're doing any type of strenuous activity, we recommend that they wear it. And then last, we also offer physical therapy. Physical therapy is very important. It strengthens the joint. It makes your muscles very strong. You work directly with a therapist. I've been recommending a lot of water aerobics just because I love water aerobics, and I think that the resistance from the water really helps the joints get stronger, and it helps relieve some of the arthritic pain as well.
So you said 5, and obviously you've done a lot of research. So the reason you came up with 5 is because 5 works. Is it once a week? How frequently do they do that?
It's once a week for about 5 weeks. So you would come. The injections have to be a week apart.
And they're in your office, so they're coming to your office together.
Exactly. Yeah.
Okay. And then how long do they have to wear the knee brace after they get those 5 injections?
Great question. So we have our patients wear it for about 3 hours post-injection. And the reason why is because it increases the space so that the hyaluronic acid can spread a little better.
Okay. And then do you find, like, do you have any statistics? Like, do you find that most people, after coming to your office, doing the 5 weeks, putting on the knee brace every time, following the correct protocol, are they pain-free? Like, what's the percentage of success?
So each patient is very different. I like to say that it's very patient-dependent. However, most of our patients, after about the 5th week, they notice a 60 to 80% improvement in their knee pain, which is significant. I mean, to even wake up or go to bed at night with not having any knee pain or having 50% less knee pain, that's a huge
it's gigantic.
outcome.
Oh, yeah.
Yes.
People would be like, I'll take 30%
right,
less at this point, right? So they need 5 injections because you've done the research and you know it works most effectively. Are there any adverse reactions?
So this is an all-natural substance. Your body naturally has it, so we're just replenishing it. The only adverse reactions are your typical with a needle to skin. So it'd be bleeding, bruising at the site. And then any type of, the only thing that I usually like to tell my patients is if they have really high sensitivity to allergies, like eggs or chicken or contrast dye, these are things that we talk to them about their past medical history and allergy history. So these are very specific to the patient.
Okay, all right, and that's good, you cover all that.
Mm-hmm.
So when do they start feeling better? Is it after the first 2, after the first 5, or even weeks after that?
So typically you notice a difference after the 3rd injection. So at week 3 is when you notice a difference. At week 4 you'll notice even more of a difference, and then at week 5 it's the biggest difference. But it's not drastic. It's not, oh wow, I have no more pain.
I can go run a marathon.
No, it's very, very gradual. Your mobility starts to increase. You're able to do the activities that you couldn't do before. It's a very, my patients always tell me this. They say, it's so funny, I was able to mow my whole lawn today, after my 4th injection. No way, I haven't been able to do that before. But like 5 weeks ago, I was only able to do 1/4 of the lawn. So it's a very gradual improvement. And that's what I like to see with my patients. I always like to tell them that because it's an unrealistic expectation. You're going to wake up with no pain. No, it's very gradual. I want you to do the protocol. I want you to go to physical therapy. I want you to wear the brace. You're going to notice a big difference along the weeks. It's not just a 1-week type of thing.
Well, and I gotta believe if they don't follow the protocol, then they're not gonna see the results that you have.
Exactly. Mm-hmm.
Okay, so tell us, how long does that pain relief last? Like, time period wise.
So it's very dependent based on how severe the osteoarthritis is, and that's why we take x-rays to make sure that we see exactly what's going on with your knees. However, it lasts at least 6 years, or 6 months, not 6 years.
I'm like, 6 years?
6 years, yeah, no. At least 6 months up to 2 years. So that's a significant amount. Most of my patients, I would say about 80% of my patients say it lasts them about 9 months to a year. Insurance will cover it every 6 months though.
Oh, they do?
Yes.
Okay, that was my next question.
Yes.
So insurance is covering
Yes,
this.
most definitely.
Medicare, because I'm assuming
Medicare, all commercial, most commercial insurances will cover it. If you have Medicare plus supplement, you are most likely 100% covered. Mm-hmm.
Excellent. That is great. So our listeners are going to need your phone number. Why don't you share that really quick with them?
Yes, of course. Our phone number is 248-952-9190, and we are located in Beverly Hills, Michigan.
And we're going to go into, in the next segment, we're going to talk in detail about the consultation. But I have a couple more questions. So the knee brace, what exactly does that do? I know you said it holds it in place.
Yeah, so it takes pressure off of the joint. So for those patients that are completely bone on bone, or they have very limited cartilage space, or that spacing between the bone, the joint, so what this does is it helps increase the space so it takes less pressure off of the joint. The brace itself is called an offloading knee brace. The brace alone can increase the space in the joint, which will help with your pain, and that's why we have you wear it.
So will people, would it work if someone just went and got this brace?
Of
No,
course.
the brace only and not even did the
Yes,
injections.
for
So
sure.
It could.
It definitely could. A lot of providers will prescribe just the brace.
Mm-hmm.
We notice that with the brace, with the injections and with physical therapy,
You get the win, right?
You get the win, yep. You
I
don't just get the 20-30% improvement, you get the 70 to 80% improvement with all 3.
And where are these braces available, just out of curiosity?
They're in our office. We actually dispense them right in the office. They're very custom fitting. So we have the patient come in for a consultation, and then we measure them based on height and weight, and we go ahead and custom order them, and then they come in within the week.
And insurance covers the brace
Insurance
as well.
covers the brace.
Okay,
Yes.
why would someone not at least try?
Yes, yes.
It's such a win-win. I'm telling you, I am so sold on you guys. I love what you do. And to have a treatment available that is not surgical. Nobody wants surgery.
No.
Like, everyone's not like jumping up and down like, I want knee surgery, I want hip surgery. Like, they do not want surgery. This is such a phenomenal alternative. I love what you guys do. I think it's amazing. And I know for a fact that you're going to get a lot of calls from this program. I wanted to share our Facebook page. It's Next Steps #4 Seniors, and you have one as well. New Life Medical.
New Life Medical, yes.
Okay, so definitely like us on Facebook. You're listening to The Patriot, FM 101.5, AM 1400. We'll be back in just a moment.